DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to Doc Talk. Look who I got here. Got Dr. John Hutcheson here from Merck Animal Health. And today we're going to have him on the show. You're not going to want to miss it. We're going to talk about things that we can do at the ranch to improve the value of your calves, improve the performance of your calves, and much more. Stay tuned.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to Doc Talk. I'm Dr. Dan Thomson, and I'm here with my friend and colleague, Dr. John Hutcheson, who is the Director of Beef Cattle Technical Services at Merck Animal Health. He has been involved in so much research. He has been involved in graduate student projects, research in the industry, leadership in the industry, and so much more. And we're just thankful you'd be on the show.
You bet. Thanks for having me here, Dan. This is awesome. I've been able to come on this show before, and I know the listeners, I at least have a few listeners out there because I get a few emails every now and then. They give me a hard time about what I'm talking about and what you're talking about. And but you know what? They listen to us and they know what we're talking about and they take action. So
absolutely.
This is a fun show to be on, and I'm glad to be here.
We're glad to have you. And John, you've done a lot of work recently on the looking at value add for calves but it goes beyond the value add. There's actual performance and costs if we don't do things right or if we don't use proper technologies.
You bet. Like, let's take vaccines. You know, they're not intended to enhance growth,
right?
But they're intended to protect the asset that you have, which is the calf, from disease. And so you can look at that two different ways. It can be a minus on your balance sheet, or it can just, maintain and allow you to apply other technologies and those good genetics that ranchers are trying to improve their herd. And so it's one of those that gives you insurance. But then there's also all these other products that have a purpose.
Yep.
I mean, they have a purpose in terms of if they do what they say they do and they're researched and you can see the results of those research projects, they enhance performance. And so take, simple things like giving an implant, a growth promotant, right? We see 20, 25 pounds of weight when we give one of those. Take a fly tag. Fly tags are out there for a reason. That's to get rid of flies. Flies they cause a reduction in performance. And so if you can get rid of those or lower that burden from a fly tag, you get better performance.
Yep.
You take deworming, right? Parasites are what they're called, right?
Yep.
They take nutrients away and rob the animal of good nutrition, and they milk less, they gain less. And so you get rid of those parasites and have a control program in there. You're going to get an additive response. You're going to get a response because you're getting rid of those internal parasites.
Yep.
And then there's feed additives. There's medicated feed additives that are out there that alter the microbial population, that allow digestion to be better and to get more energy, and those enhance performance. And so there's a lot of those things that producers can do. There's like 4 or 5 of those things that might show an additive response that we ought to talk about a little bit.
Well, and we will. But when you start to talk about the additive response, it's not impossible to think of 30, 40, 50 pounds on a calf that you're going to
Yeah, no, that's right. That's exactly right. When you look at the data that's been generated with some of these studies where, you test one product and then you test them singly, they give a response. Then we test them together, maybe 2 at a time or 3 at a time. Most of the studies have only gone up to about 3 at a time. But, if they have different modes of action and working the animal differently, they become additive.
Yep. Well, it's no different than when you're sitting down looking at your budget. And you have different things that are cost centers and things that are revenue centers, and you employ the things to decrease your costs and increase your revenue, wind up with a little bit more in your pocket.
You bet. Oh, that's exactly right.
It's excellent. We're going to take a break. When we come back, more with Dr. John Hutcheson. You're watching Doc Talk, and we're glad you joined us.
This Cattle Intel is brought to you by Neogen.
Hello there, Dr. Nick Wagner, Professional Services Veterinarian with Neogen, and just wanted to take some time today to mention an important point about water quality. And when we look at providing quality water to our cattle, whether that's in a pasture setting or a feedlot setting, we want to make sure that we're looking at what does quality water look like. You want it free from any potential contaminants. You want it to be at a pH that's between 6.8 and 8 to keep it at a neutral so that you don't cause any problems with rumen health. You want it to basically be free of minerals like nitrates and sulfates that could potentially be detrimental at certain levels to cattle that could cause health issues, but also the other piece of it with minerals and contaminants that could also be a challenge is it could just affect the overall palatability of that water source. And if it's not palatable to cattle, they're not going to drink it. And so if you're looking at getting your water tested, you can reach out in a lot of cases to your extension services in your area, and they will put you in contact with a laboratory that you can send a water sample to. They'll provide you analysis back, and then you can discuss that with your veterinarian if changes are needed to ensure the best health and welfare for your cattle.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Identity Feeder. Identity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Identity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Identity Feeder.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
John McCurry with McCurry Angus Ranch. We are standing right now in our fall yearling bull pen. On our first initial run with therapies, we commingled 3 separate different pens of bulls together for the ones that's in the sale, and had virtually no issues with these cattle in terms of commingling them and their attitudes towards each other. Didn't have the riding and the fighting that we normally can experience. And I would highly recommend us using therapies and would recommend that to anybody else looking to do so.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thomson with Dr. John Hutcheson, and Dr. Hutcheson is the Director of Beef Cattle Technical Services at Merck Animal Health, and he is one of those people in our industry that when he speaks, I listen. I thought we'd break it down and talk about vaccines and fly tags, and then we'd talk about implants and parasite control. So let's just lead off with the fly tags.
Yeah. So, flies are a nuisance. They suck blood, they bite. You see cattle, it's the thing that I wish producers would notice driving down the road. I think they sometimes get caught up in whatever it might be that day driving down the road.
Yep.
But in the summertime, you see so many cattle bunched up. And I being a nutritionist by training, I see all those cattle bunched up and fighting those flies. And what are they not doing?
Right.
They're not out grazing.
They're not grazing.
And so, you just got this insult to them that, needs something done. And it's hard, but there's a simple solution, as it relates to fly tags, and they've got to be managed correctly. You got to understand, there's different chemical compounds, and there's some things you got to do to try to, not create some kind of resistance problem as it relates to those different flies and whatnot. But, there are really easy way, preventative, to create a preventative, keep those flies and fly pressure down so they're out grazing.
Yep.
That's why they got the big rumen. That's why they're out on grass, is to graze, not to be bunched up.
And it also helps with prevention of pink eye and just, some of the other infections and some of the diseases that can be transmitted by those flies.
You bet. Kind of almost leads us down into the road of the vaccinations.
Yep,
Speak of pink eye, right? Those flies are causing those insults to the eye. They carry bacteria. And so, when you talk about pink eye protection or prevention, right, it's vaccination.
Yep.
Our vaccinations are preventative measures.
Yep.
If you don't vaccinate and they get pink eye, or you don't vaccinate and they get a respiratory disease, right, that's detrimental to that animal's health and performance, and maybe, end up even in a worse place as it relates to mortality. Right. And so yeah, you think of these preventative programs. There's always the environmental part of it, like keeping things clean, keeping forage mowed down at the right height. Yep. You got all those kind of things. You got these flies; they're part of the environment, but you have ways to control them. You have ways to control the forage height and keeping the manure clean so flies don't breed. And then you got a vaccine. Yep. And so that's all part of that preventative, those fly tags and vaccines. And think about respiratory disease. I mean, those calves, when they're young, are more susceptible to disease, just like our kids were. And what did we do? We vaccinated them appropriately in the right timing so that we could prevent diseases.
And I think that when you look at the cow herd in total, whether it's the flies or the vaccines, you've got calves, developing heifers, bulls, and cows, and having that program for each one of them is vital.
Yeah, absolutely. I mean, it doesn't matter. The cows are bunched up, the calves are bunched up, the bulls are right. I mean, all of them, and they all have equal access, so to speak, to diseases. Yep. And they have equal access to flies. And so how you protect them to prevent those things from happening, i.e., right, we're trying to prevent disease and prevent fly pressure to be to where they're not out grazing.
Yep. I think of it as, we want to get the cows bred, get the calves on the ground, get the calves weaned, and in between there, maximize performance. And if that cow's milking the most, the calf's going to grow more.
That's right. And in the middle is a lot of opportunity.
Yep.
Right? There's a lot of opportunity for application of prevention programs and application for growth promotion programs that help a producer.
Leaves us right to our next segment. We're going to take a break. We'll come back. We'll talk about those things that can promote growth.
Every farmer knows that understanding the landscape is the most important ingredient for success. When it comes to investing in precious metals, United Patriot Coin can help steer you in the right direction. No obligation, just solid advice. Call now for your free guide, 844-202-7834.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Couperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism, then bite back at safeguardworks.com.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. John Hutcheson, who's the Director of Beef Cattle Technical Services at Merck Animal Health. Incredible company, and he has an incredible team, and they have incredible leadership with Dr. Hutcheson. We have talked about the things that were prevention. Now let's get into some of the stuff that's kind of near and dear to yours and my heart.
You bet.
Implants and parasite control.
Absolutely. Things that enhance growth, enhance, enhance pounds. And obviously you got to have those preventative measures in place so that we know disease, throttles back performance. And we know those flies throttle back that good genetics they've been putting into their calves. But let's talk about implants. It's the easiest thing. It goes in the ear, goes under the ear. You put an implant in. It it affects the endocrine system. You did a little bit of work on the endocrine system and implants a little bit over a few years ago. You're much younger than I am, and so. But you got the endocrine system and you got some endogenous hormones going on, and so those animals are leaner. They got a little more frame to them. And most importantly, they got more weight. And so, a suckling calf responds to that implant. A weaned calf, if you're keeping weaned calves on for some kind of summer grazing or some kind of winter grazing or whatever you're doing, or putting them in a dry lot or whatever that may be, they have the opportunity again for some enhancement. And then there's parasites. Parasites are in their name, right? They take nutrients away, they suck blood, they do all these terrible things to the intestines, to the small intestine. And I always show people, I think the best way to impact people's thought process on parasite control is show them the damage that they do in the guts, in the stomach, the abomasum, the small intestine. And those are supposed to be, things where we absorb nutrients. And it's almost like the body is not allowing that to happen. And so, you get rid of those, and then you enhance performance in those same classes of animals, right? Your cows get in better condition, body condition drives reproduction. Those calves are heavier at weaning. There's more milk. Those bulls are in better condition. They work hard through breeding season, and then, why do we got to still pay attention to them. And then any wean calves, as they, where all the parasites are on the pastures they're grazing. So they can't get away from them just because you treat them once. And so there's strategies for that.
Yeah, and we've got replacement heifers and stockers. It's just another class of animal that's on our farm or going through our farm that requires its own vaccine, implant, parasite control strategy. So it's in these buckets of things we need to do within the different classes of cattle that we have on the farm.
Yeah, no, that's right. And producers have to have a plan. And they can get help for plans, right? They got their local veterinarian, they got their local maybe livestock extension specialist. Right. They've got a lot of resources, companies like ours. You mentioned my team. There's a team of Beef Cattle Tech Service folks that are 10 veterinarians and 6 nutritionists. And so there are all these different classes of animals have different needs as it comes to growth promotion. We obviously aren't implanting cows, but we are the calves and we are the wean calves, and in some instances we can the replacement heifers if we do it appropriate to the label. And so they all have opportunity to enhance performance.
Leads us right up to the grand finale. We're going to do a segment coming up when we talk to you about how it all adds up on your ranch. You're watching DocTalk, and we're glad you joined us. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. John Hutcheson. We're at Merck Animal Health, where Dr. Hutcheson serves as the Director of Beef Cattle Technical Services, has an incredible team that he leads. And if you've been in the industry and you've gone to presentations or seen research, you've listened to Dr. Hutcheson, and he's one of those that I can call up and get great advice and help me with cases. And so I just appreciate all the work you do.
Yeah, no, thanks, Dr. Thompson. Absolutely. And thanks for giving a shout out to the team, because I'm just the person that serves that team at Merck Animal Health. But it's fun, and everybody has the same desire, and that's to help producers like this show and give them something to think about, and maybe hopefully they implement some of the things we talk about that are, well-rounded, science-based, kind of decisions that we're talking about. And, and hopefully it makes sense to everybody out there.
Big time. So we talked about flies, we've talked about vaccines, we've talked about implants, parasite control. I mean, what kind of money are producers, if they're not dialed in and they're not taking care of this, what kind of money are we leaving on the table?
You bet, you bet. So let's talk about it in one way, and then we can do some multiplication times some pounds. But you think about fly control, and you think about those calves that aren't grazing, and we put fly tags on, or we apply some kind of fly control. You'll see anywhere from 20 to 25 pounds, and so keep that marker in your head.
Yep.
So 20, 25 pounds, and then let's take an implant, and so just over and over and over, it's like on average, it's all our data says about 23 pounds.
Yep.
So you got 23 pounds, and so let's add up parasite control. So we've done enormous amounts of studies, and there's a couple of things that go on with parasite control. So hope everybody's listening well here. There's the weaning weight that you get. There's the 25 pounds of weaning weight that we see. There's also some weight on wean calves that we can see, but let's go with 25 pounds of weaning weight. But the other thing that we don't sometimes forget to do the accounting is those cows will breed back better if they're in better condition and got rid of the, and so we'll see some reproductive rates improve. And then most importantly is the weaning weight is coming from also the milk production that's not being stymied by those parasites. And so think about those things. We got fly control about 20, 25 pounds, 23 pounds on an implant. We've got 25 pounds on a parasite control program. And everybody always says, well, I can't get 75, 80 pounds. Well, you can. And why you can is that they all three affect different part of the systems.
Right. Yep.
I mean, you got the flies are outside and we're driving them away. Internal parasites, we have them inside the animal and we're getting rid of them out of the animal. And then the implant works through the endocrine system. And so all separate, and so they are additive. We've got research to back that up that demonstrates that when you do all three, you get an additive response.
Yeah, it's if you have 100 calves and it's 70 pounds,
Yes.
I mean, you're talking 7,000 pounds
Yeah, and
of cell.
and if you're talking about today's prices here in 2024,
Yep.
it's they're $2.80 a pound.
Yep.
$3 for easy math. That's
It's
an extra
$150,
yeah,
$200 bucks.
$200. And I know that sounds unreal, but it's not. Now, if I apply a whole bunch of technologies to just fly control, yeah, they're not going to be additive, right?
Right.
They're going to drive those flies away, and that's the big response. Same with implant. I can't put, if one implant gives me 25 pounds, I can tell you this for sure. This is a fact. You can't give 4 implants and get 100 pounds.
Right.
Okay. It's one implant, 25 pounds. They work in different modes of action.
It's awesome. Thanks for being on the show.
You bet. Thank you for having me.
You bet. Thanks for watching DocTalk. Remember, if you want to learn more about what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson with Dr. John Hutcheson, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.